Have you ever really stopped to think about how your mouth might be connected to, pretty much everything else in your body?
It's something we're realizing more and more.
Yeah, I mean, we're not just talking about like a nice smile or fresh breath here. We're diving into some really deep, fundamental links, things affecting your entire systemic well-being.
Exactly. For too long, I think healthcare has kind of treated the mouth like this separate island, you know.
Totally separate.
But the science, especially some really comprehensive new research, is making it super clear the mouth is absolutely integral. It's like a mirror, sometimes even a gateway
Right.
to what's happening inside.
Okay, so let's really unpack that connection today. We're doing a deep dive into a really significant piece of research that pulls the curtain back on exactly this, the oral systemic link.
Hmm.
It's what's called an umbrella review, titled An Umbrella Review of the Evidence Linking Oral Health and Systemic Non-Communicable Diseases. It was published in Nature Communications by Juan Botelho and his team.
Right. And our mission today, really, is to get to grips with the core findings of this review. It's quite a big one.
Yeah.
We want to explore what it tells us about that relationship, often a two-way street, between oral health and the systemic non-communicable diseases, NCDs.
And crucially, what it all means for you listening, especially if you happen to be a dental professional, or maybe you're just really curious about this link for your own health.
Absolutely.
So let's start right there with that term you mentioned, umbrella review. What exactly is that, and why is it such a powerful way to look at something complex like this?
Okay, think of it like a pyramid of evidence, right? At the bottom, you have individual studies.
Okay.
Then someone does a systematic review, gathering lots of those studies. Then maybe a meta-analysis, which statistically combines results from multiple studies to get a stronger picture.
So it gets more powerful as you go up.
Exactly. And an umbrella review sits right at the top. It's literally a review of those meta-analyses. It's synthesizing already synthesized research.
Wow. Okay, so they're taking these big summaries of research and then summarizing those. That sounds like the ultimate bird's eye view.
It really is. It lets researchers look at the highest level of evidence out there. And in this specific review by Botelho's team, they covered, get this, 293 systematic reviews.
293.
Yep, containing 855 separate meta-analytic comparisons. It's just a massive amount of information condensed down.
That is incredible. It's like the final word on a whole bunch of related topics at once.
Pretty much. It gives us a really robust picture.
So with all that data crunched, what's the main headline, the core revelation? You mentioned a bidirectional relationship.
Right.
We kind of get one direction, I think. Like if someone has an NCD that makes it hard to, say, brush their teeth effectively.
Yeah, like due to physical limits or cognitive decline.
Then it makes sense their oral health might suffer. More cavities, more gum disease. That feels intuitive.
Absolutely. That side of the coin is pretty well established. What's really gaining traction now, and what this review powerfully reinforces, is the evidence for the other direction.
The reverse.
Exactly. How oral diseases themselves, things like gum disease or even tooth loss, can actually act as potential risk factors for developing systemic NCDs.
Okay, now that's where it gets really interesting and maybe a bit startling.
It is. And this review found strong associations between oral diseases and, wait for it, 28 different non-communicable diseases.
28. Seriously, that feels huge. Way more than I would have guessed. What kind of diseases are we talking about? Give us some of maybe the most striking examples.
Okay, well, brace yourself. Let's start with cancers.
Cancers, wow. What did they find specifically?
Yeah, 5 types showed strong links.
Yeah.
Things like lung cancer and pancreatic cancer were associated with tooth loss or being completely toothless edentulosum.
Yeah.
And then breast cancer, prostate cancer, and head and neck cancers showed strong associations with periodontal disease, so gum disease.
That's genuinely shocking. Linking gum disease to something like breast or prostate cancer, it really shifts your perspective, doesn't it?
It really does. It suggests the mouth isn't just this isolated area.
Okay, what about metabolic conditions? We hear a lot about diabetes and oral health. Was that confirmed?
Yeah, absolutely. Metabolic conditions were definitely on the list. Diabetes mellitus, that well-known two-way street, was strongly confirmed.
Right.
But also obesity, specifically linked with edentulism. And then some perhaps more surprising ones. Non-alcoholic fatty liver disease, NAFLD, and polycystic ovarian syndrome, PCOS. Both of those showed strong links specifically to periodontal disease.
Fatty liver disease and PCOS. Linked to gum health. Okay, the connections are broader than I imagine. What about heart and brain health? cardiovascular and neurological stuff?
Yep, those were prominent too. Cardiovascular diseases, CVDs, definitely there. And also neurodegenerative conditions, think cognitive impairment, dementia,
Oh, wow.
and even stroke, all showing strong associations with both tooth loss and periodontitis.
So losing teeth or having severe gum disease could be linked to dementia or stroke risk.
The association is strong, according to this massive review. It really paints a picture where heart and brain health might have roots, partly in oral health.
Okay, and inflammation seems to be a running theme in a lot of systemic issues. Did they find links to inflammatory or autoimmune conditions?
You nailed it. Inflammation is key. And yes, things like rheumatic diseases, rheumatoid arthritis, ankylosing spondylitis, they found links. Also inflammatory bowel disease, IBD, and psoriasis.
Psoriasis too.
Yep. And interestingly, all of those were strongly associated specifically with periodontal disease. It highlights how that chronic inflammation in your gums doesn't just stay put.
It sends signals out, basically.
That seems to be the idea.
Were there any others on that list of 28 that, really made you pause? Like truly unexpected links?
Oh, definitely. How about depression?
Yeah.
Linked strongly with dental cavities and tooth loss.
Depression linked to cavities. That's hard to wrap your head around initially.
Isn't it? And then asthma associated with periodontal disease and also mouth breathing, gastric Helicobacter pylori infection, the stomach bug linked to ulcers,
Yeah.
linked to periodontal disease, even something quite specific like medication-related osteonecrosis of the jaw, MRONJ, which is a known serious side effect.
Right, from certain drugs.
That also showed a strong association with having periodontal disease beforehand. Then you've got obstructive sleep apnea, and maybe one of the most surprising, iron deficiency.
Iron deficiency. From what? Cavities? How does that even work?
It seems counterintuitive, right?
Yeah.
But the thinking is it might be related to chronic inflammation or perhaps nutritional issues if severe dental problems make it painful to eat properly, especially in kids.
Ah, okay. So the body's inflammatory state triggered by the mouth could mess with iron levels.
That seems to be a plausible pathway. And the review specifically pointed out that C-reactive protein, CRP, a key marker of inflammation in the blood, was also strongly associated with oral diseases. So that inflammation link seems really central.
Okay, so across all these conditions, cavities, gum disease, tooth loss, was there one type of oral problem that stood out as the main driver for most of these systemic links?
Yes, definitely. The review was pretty clear that periodontal disease accounted for the lion's share, the vast majority of these strong associations.
Gum disease is the big one.
It really seems to be. Probably because it involves that chronic inflammation and potentially allows bacteria and inflammatory signals to get into the bloodstream more easily.
And what about tooth loss, edentulosum? That came up a few times.
Right. Tooth loss and being completely toothless, edentulosum, are often the end result of severe gum disease or widespread cavities. So they're significant markers too and show their own strong links to things like cancers and neurodegenerative conditions.
Okay.
But the review also found strong associations directly with dental caries and endodontic infections, infections needing root canals. So it's not just gum disease, but it does seem to be the biggest player.
This all sounds incredibly convincing. 28 diseases, hundreds of meta-analyses. But science always has its caveats, right? The report mentions something about methodological issues and the overall strength of evidence seeming unfavorable at first glance. How do we square that with these really strong findings?
That's a really important point, and it highlights the careful interpretation needed.
Yeah.
Yes, the review did find issues with the methodological quality of many of the individual meta-analyses they looked at.
Like how the original studies were summarized wasn't always perfect.
Exactly. They use a tool called AmStar2, and a high percentage of the included meta-analyses were rated as critically low quality. So that sounds bad, right?
Yeah, it sounds like maybe we shouldn't trust the results.
But here's the crucial part. They also use something called fail-safe number statistics. And these numbers indicated that the significant findings, those strong associations we've been talking about, are actually unlikely to change in the future.
Unlikely to change. Okay, unpack that fail-safe number thing. What does that mean in simple terms?
Basically, it asks, how many new studies showing absolutely no link would you need to find and publish to make this statistically significant result disappear?
Ah, okay.
And for these strong associations, the answer was an improbably huge number. It would take a mountain of future studies showing nothing to overturn the current findings.
So even if some of the building blocks, some of the individual meta-analyses had flaws,
The overall structure, the main conclusion about these specific strong links, is remarkably solid. The review calls it a fairly robust consistency. The signal is strong, despite some noise in the data.
that makes sense. It's a critical distinction. The core message holds up. Okay, let's pivot slightly. We know the links are strong. What about treating oral problems? Can that actually improve systemic health? Did the review look at interventions?
Yes, and this is maybe the most exciting part for clinical practice, moving from observing links to seeing if we can make a difference. The review specifically looked for strong meta-analytical evidence, so high-level evidence, again, showing that oral treatments had a systemic impact. And they found it for 2 specific interventions.
Only 2 with strong evidence. Which ones?
First, periodontal treatment treating gum disease was shown to have a strong impact on reducing systemic inflammation. So cleaning up the gums demonstrably cools down inflammation throughout the body.
Wow, okay. That's direct impact. Where was the second one?
The second was endodontic treatment. So root canal therapy showing a strong impact on cardiovascular diseases, CVDs.
Root canals helping heart health.
That's what the strongest level of evidence suggested in this review, resolving that deep tooth infection seems to have benefits for the cardiovascular system.
That is fascinating. Direct, measurable impact. Were there other areas where treatment looked promising, even if the evidence wasn't quite at that strong level yet?
Yes, definitely. There was what the review called highly suggestive evidence for periodontal treatment, also positively impacting CVDs. Again, metabolic disorders like diabetes control, adverse pregnancy outcomes.
Pregnancy outcomes, too.
Yeah, things like preterm birth or low birth weight, also respiratory diseases, and again, confirming its role in reducing systemic inflammation. So, while maybe not reaching that highest bar of evidence yet, the signs are very encouraging in these areas too.
Okay, so let's bring this all together. What are the big implications here? Particularly for dentists listening, but really for all of us as patients, too. It feels like this fundamentally shifts how we should view the mouth, right?
Absolutely. It's a call for a paradigm shift, really. Moving towards what the paper calls a global view of health within dentistry. Stop seeing the mouth in isolation. It's connected deeply.
So if I'm a dentist, how does this change my day-to-day? How does it enhance clinical decision-making or treatment planning?
Well, first off, risk assessment takes on a whole new dimension. It's not just ticking boxes on a medical history form anymore. It means actively considering, could this patient's systemic condition, like diabetes, be driving their gum disease? And crucially, could this patient's severe periodontitis be increasing their risk for, say, cardiovascular problems or making their diabetes harder to control?
So it changes the conversation you might have.
Definitely. Take that patient with severe periodontitis again. Now, the dentist understands this isn't just a mouth problem. They can say something like, look, getting this gum disease under control is critical, not just for saving your teeth, but research strongly suggests it can help lower inflammation throughout your body, which might benefit your heart health or help with your diabetes management. Let's make sure your physician is aware we're working on this.
That really connects the dots for the patient and potentially prompts a conversation with their doctor they might not have had otherwise.
Exactly. It fosters that necessary communication and potential referral. It also broadens the goals of dental treatment. When you treat that periodontal disease or that endodontic infection, you're not just aiming to fix the local problem. You now understand and can communicate to the patient that you're potentially delivering systemic benefits too.
Like reducing their overall inflammation, maybe impacting CVD risk?
Precisely. It elevates the value and purpose of dental care beyond just the teeth and gums. It's about contributing to the patient's overall wellness.
This seems like it puts a huge emphasis on prevention and patient education, too. Not just fixing things, but stopping them before they start, with this bigger picture in mind.
Absolutely. The article heavily advocates for focusing on prevention, primary, secondary, tertiary, and tackling those modifiable factors.
So for dentists, what does that mean in practical terms?
It means maybe identifying patients who are at higher risk because of systemic conditions and implementing more targeted preventive programs. It means doubling down on oral health literacy.
Explaining these connections.
Yes. Helping patients understand why flossing isn't just about preventing cavities, but about their systemic health. Why managing their diabetes helps their gums, and vice versa.
Yeah.
It's about empowerment through knowledge.
And using reliable diagnostics, obviously, providing the right treatments.
Of course. All done with this awareness of the broader systemic implications.
It really feels like the ultimate goal here is breaking down silos in healthcare, more collaboration.
That's a huge takeaway.
Yeah.
This review powerfully underscores the need for much greater multidisciplinary care. Dentists, physicians, specialists needing to communicate better, share information, work as a team.
Like your dentist talking to your cardiologist.
Potentially, yes. The paper even suggests changing medical and dental school curricula to really embed this One Health vision from the very beginning of training. It's a long-term vision, but essential for truly patient-centered care.
What a takeaway message. Oral health isn't separate. It's fundamental to overall health. This review seems to cement that idea with some really solid evidence.
It truly does. Understanding this two-way street is, well, it's vital for healthcare providers and for every single one of us managing our own health.
It leaves you thinking, doesn't it? If we really embrace the mouth as integral, what could healthcare look like? Imagine a future where every medical checkup includes a thorough look at oral health, and every dental visit involves a real conversation about your overall systemic wellness.
It's a future this research certainly pushes us towards. Makes you think twice about skipping that floss tonight, maybe.
Definitely gives you food for thought. We encourage you, our listeners, to keep exploring how your own oral health plays into your bigger health picture. Until next time, stay curious and keep diving deep.